My name is Jessica, and currently starting off this test in my dorm room, um, and with the help of my client, Shyla. Okay, for the anterior cruciate ligament, one common test is the anterior drawer sign test, which is where you have the person, like my lovely assistant, our client, laying down, and then you put their knee into a 90-degree flexion, and you some people like put their foot or like put their weight on their foot, and then you gently move their leg forward, or their tibia gently forward away from the body while the knee's flexed. If the test is positive, that means that when the tibia is pulled forward, that there's an excessive amount of movement. A positive indication of this that you might feel or see is an increase in anterior translation, or a soft endpoint journey. Okay, I'm kind of in frame now. We're gonna do an assessment on the posterior cruciate ligament. The test that we're gonna do is the posterior drawer test. This test is done by bending your knee at a 90-degree angle. We're doing the other knee because it works for the angle that kind of went together. And you're gonna do this by applying a bit of weight on their foot, so it ain't moving. And you're gonna apply force backwards, push on their tibia posteriorly, and palpate the joint line and so go that. I'm a little bit nervous about actually doing it. That. Okay. If this was a positive test, what you would feel is a softer or mushy feel, kind of, and that would indicate a positive test. What you would see that would indicate that it's a positive test is that you would see that there's a posterior translation of more than 6 millimeters would indicate that it's a positive test. For this one, we're going to be assessing the medial collateral ligament, and the test that we're going to be doing is the volvulus stress test, which you're going to have your client lay on the ground, their legs fully extended. You're going to grab the lower part of their leg just above their ankle, and then with your other hand you're going to use it to fixate the femur, and you're going to then slowly externally rotate the tibia and perform a passive abduction in the knee. A positive finding may include an increase or an excessive gap in medial joint space opening, or pain when the force is being applied to the knee. Okay. Good job. We're going to be doing, for this assessment, we're going to be assessing the lateral collateral ligament. This test is basically the same for the last test that we did. We're going to be doing the various stress tests, which is what's done on the lateral side. This test is done by having your client lay on the floor, or on their back. It doesn't have to be the floor, but we're slummy like that. And you're going to have your one hand on their ankle, your other one medially on their femur, and on the medial side of their femur. and you're going to apply lateral rotation in the knee joint and perform passive abduction in the knee. So that's this. And you're also gonna then perform the same test, but with the knee in a 20 to 30 degrees flexion, and you're gonna do it the same thing. And basically, a positive finding would include lateral joint space opening or pain when force is being applied to the knee. Okay, lastly, we're going to be evaluating the meniscus by doing the McMurray test. To do this test, you're going to have your client on the floor, on their back, or anywhere, but on their back. And you're going to have their leg fully flexed. And we're going to start by medially rotating and then extending, seeing if we feel anything. And then you're also gonna laterally rotate while also doing this, seeing if you feel it. Anything, a positive test finding, you may feel softening or irregularities during the test, which you could also feel maybe the popping up here, and you may even hear clicking, popping, or the person may have pain, and they may express that pain. Hopefully not by kicking you.